Hey everyone, welcome back to Mr. Teeth. In today's video, we're talking about a very commonly asked topic in oral pathology, oral lichen planus. But to make this really easy to understand, I've divided this topic into simple parts. This is part 1, where we'll discuss what is oral lichen planus, OLP? Why does it happen? How does the disease develop? Pathogenesis. So, let's get started. Small blue diamond, what is oral lichen planus? Oral lichen planus, OLP, is a common chronic mucocutaneous disease, which means it affects the mucous membranes of the mouth and sometimes the skin. It was first described by Wilson in 1869, and it affects around 1 to 2% of the world's population. OLP is considered an autoimmune condition, meaning the body's own immune cells mistakenly start attacking its own tissues. Small blue diamond, why is it called lichen planus? The name comes from the resemblance between the lesions seen on the skin and a primitive plant-like organism called lichen, which grows on trees and rocks and has a flat-topped appearance. Lichen, because the lesions resemble plant lichen planus, Latin, means flat. So together, lichen planus describes the flat-topped lesions found in this condition. Small blue diamond, how does it look in the mouth? Oral lesions. In the mouth, you typically see white, lace-like patterns on the cheeks, white patches or plaques, sometimes red, ulcerated, or painful areas. Oral involvement often appears before any skin involvement. Small blue diamond, etiology. Why does OLP occur? The exact cause of oral lichen planus is still unclear. However, research suggests that it is a T-cell-mediated autoimmune disease. Specifically, cytotoxic CD8+ T lymphocytes mistakenly attack the oral epithelial cells. These immune cells identify a self-antigen on the surface of oral keratinocytes. This triggers apoptosis, cell death, of those epithelial cells. In simple words, your own immune system starts attacking the cells of your oral mucosa. Activated immune cells also release cytokines, which attract more inflammatory cells and worsen the lesion. Small blue diamond, factors that can trigger or unmask OLP. Although the condition is autoimmune, several factors can trigger its onset. 1. Medications, drug-induced lichen planus. Examples: antimalarial drugs, some antihypertensives. This form is called lichenoid drug reaction. 2. Dental materials, contact hypersensitivity. Certain materials may trigger lesions. Dental amalgam, restorative materials, flavoring agents in toothpaste. 3. Trauma, Koebner phenomenon. New lesions may appear at the site of repeated trauma, such as cheek biting, sharp tooth edges, ill-fitting dentures. 4. Stress, a very important factor. Lichen planus is more frequently seen in people under emotional stress. Highly anxious or nervous individual stress often causes flare-ups. 5. Systemic conditions. There is a well-known association involving 3 conditions: lichen planus, diabetes mellitus, hypertension. This triad is known as Grinspan Syndrome.